name is Dr. James Kisia. I'm the Executive Director at the International Center for Humanitarian Affairs here in Nairobi. And today I am talking to the Director of Africa Initiatives and Clinical Assistant Professor at Institute of Health Metrics and Evaluation at University of Washington, Dr. Tom Achoki. Dr. Achoki is a clinician and an epidemiologist with over 10 years experience in population health. And we are talking hot off the heels of a launch of a report, the Global Burden of Diseases report, generating evidence and guiding policy in Kenya. Tom, welcome.
Thank you.
Yeah, I think the first questions would be to ask you to briefly tell us about the Global Burden of Disease study.
Good. Thanks, James, and thanks for having me. The Global Burden of Disease study is the largest and most comprehensive study across the world, which really measures the epidemiological trends and levels across different parts of the world, which is, to date, we have covered 188 countries. We cover over 300 diseases and their risk factors. We give you a comprehensive information about injuries, different diseases, and this is very useful for decision makers who really want to understand how their health systems are performing, where they're making progress, where they're lagging behind, and areas where they can actually be able to intervene, or rather invest, and be able to use that information to improve population health.
Perhaps you can tell us more about the Kenyan report. We have launched a country-specific report, and it has its advantages and its disadvantages, and even more importantly, it has potential for use. And perhaps you can talk about the data itself, the accuracy of the data for Kenya, and what are the gaps that we would need to fill, and what would you need to do?
This is a very important report, which has come out of a collaborative effort between ICHA and the International Center for Humanitarian Affairs, the first of its kind in the Kenyan landscape, which is a very useful report to guide based on what the estimates we have from the GBD, Global Burden of Disease of 2013. We have put together a report that is tailored specifically for the Kenyan health policy implications. It's at the national level. We are being able to look and say where Kenya has made progress, where Kenya is lagging behind, opportunities to intervene, areas where they can be able to decision makers can be able to act and be able to really improve population health. These are the kind of collaborative efforts that ICHA as an institution is very keen to foster, so that research is not just done as research that sits in journal publications, but being able to see that you can actually have policy implementation and using that information to guide decisions. Especially what has come out very clearly from the discussions we're having is looking at how this kind of information can be used in determining resource allocation in health, which is a very topical point, discussion and debate in the country right now. Coming to the gaps, this is an iterative process. There are a lot of data gaps, especially if you look at things like the non-communicable disease, different areas of health. So in ICHA, our principles are, in the effort to be very comprehensive, we cover all the diseases, we characterize an uncertainty around the estimates that we have, and that is to say that as we have this information, we want to find ways that we can narrow that uncertainty. And how do we do that? Is by collecting more quality data so that we can be able to pinpoint areas where the more attention is needed. And I believe that is something that we need to invest as a country. The burden of disease is updated on a yearly basis. So as we move towards a stronger collaboration in the country, these estimates will become more useful and iteratively improve, since we are going to have better data collection in Kenya and more data being identification of more data sources that can be used for this particular effort.
Yeah. So what are the trends in Kenya?
One of the most interesting trends you realize in Kenya is there has been progress in reducing under-fire mortality. There has been tremendous progress in addressing communicable diseases. So malaria has gone down. You are seeing things like maternal mortality is on the decline. You're seeing interesting trends that are quite, which the Kenyan health system should be applauded for. In as much as that progress has been made, there are some areas where one of the things that is very clear is those diseases are still priority. Conditions like HIV/AIDS are still priority in the Kenyan landscape. Malaria is still priority in as much as progress has been made. So the trends that we are seeing here is progress is being made, but we need to keep the foot on the pedal to accelerate that progress. There is a worrying trend that non-communicable diseases are on the rise. If you look at the contribution in terms of total DALYs, non-communicable diseases like diabetes, things like cancers are contributing a significant amount of DALYs over the last 23 years. Risk factors are also on the rise. Hypertension is increasingly affecting younger age groups. You're seeing things like obesity on the rise among women. So that's one thing that really deserves attention of the policymakers in the country, so that we can be able to address those issues as we move forward. Injuries are also an important area that the country needs to look at. The road traffic crashes, which can be prevented. And I believe the work that Kenya Red Cross is doing in that area should be applauded in terms of being able to really work on being able to bring those trends down.
Yeah. Now, let me, when you look at the country data, they can be deceiving. For example, we talk about the maternal mortality in Kenya going down. But if you look at counties like Mandera and Wajir, you find that they have some of the highest maternal mortality, almost rivaling South Sudan and other, conflict countries. And yet we don't have very good data on that. A lot of them is estimates. How does a researcher work with the counties in order to give the county executives or the county policymakers at subnational level the evidence that they need to have policy that is relevant?
Good. So actually that's in the works within this collaboration between ICHA and the Kenyan health system. And in the 2015 iteration of the Global Burden of Disease, Kenya will be one of the first countries, if not the first country in Africa, to be getting subnational burden of disease estimates. And these burden of disease estimates are going to be at the county level, so we can be able to understand the heterogeneity that happens across the country. If you take a national estimate, you tend to mask the differences across the country. So you're likely to find areas in places like in Homa Bay are going to probably be more on infectious diseases. But if you come to places like Murang'a, you're going to have a different disease profile. So we definitely want to use this opportunity to get estimates that can be able to guide policies at that local level, so that decision makers can pinpoint the areas that need to, priority areas in those local areas. That said, the biggest challenge in getting into the subnational burden is, one, being able to find the data within the country to be able to drive those estimates. That is something that the beauty of the global burden of disease is an iterative process. So We will provide estimates based on the modeling that we are able to do, where we are very expert. If you look at what ICHA has been able to produce for a number of countries where subnational burdens of disease have been done, it's a very informative piece of work. We will then iteratively, as we identify gaps in terms of data, like in areas like Mandela, then we can be able to say, well, we need to collect this piece of data. And that's where the country collaborators, the health ministries, and the other collaborators in the country can be able to come together and say, how do we improve the data that we have so that we can be in a firmer evidential base in terms of what we are using. Yes.
Very good. Now, talk to us about the role of partnerships in all this, because we know that one single organization cannot do this. You have, like, for example, for this report, you have a partnership between our organization, the International Center of Humanitarian Affairs, the Ministry of Health, and IHME. I'd like to hear more about the forms of partnerships that you are looking to formulate, and what strengths are you looking to cultivate?
Good. That's at the core of IHME's transformative agenda in this space of health measurement. We realized very early on that we're very strong in the quantitative side of it. We can be able to produce a lot of research that comes out. One of the things that we want to strengthen is also that aspect of policy translation. By policy translation, I mean, as we provide the evidence, we have to partner with country-level collaborators who understand which data pieces we need to include. How do we navigate this particular process of making sure that our evidence can be taken up by decision makers? And we're very privileged that in Kenya, this report would not have been possible without the kind of collaboration we have with ICHA, which is really shown a lot of leadership in getting this agenda right from the beginning to the end, as we're having this report. And we want to strengthen this kind of collaborations because, research by itself is, as much as it is very informative, it's not as it becomes more important when you get decision makers taking it up and making sure that these decision-making processes that go into that.
It's a first step, isn't it? Research
is a first step, exactly.
Yeah.
It's a first step towards the process of being able to translate it so that it can be used for improvement of population health.
Yes.
And this is something that we really want to move beyond and be able to foster. And this is basically the beginning of this kind of relationships, and we're very excited to see how we can foster those further, and especially in what we call capacity exchange.
Yes.
So ICHA is very keen on that aspect of capacity exchange across with the different collaborators.
Okay, well, thank you very much, Tom.
Thank you.
I was talking to Tom Achoki, Director Africa Initiatives and Assistant Clinical Professor at IHME at University of Washington in Seattle. Thank you very much.